I'm Amber Tresca, and this is About IBD. I'm a medical writer and patient educator who lives with a J-pouch due to ulcerative colitis. It's my mission to educate people living with Crohn's disease or ulcerative colitis about their disease and to bring awareness to the patient journey. Welcome to episode 153. If you don't live with an IBD or another digestive condition, how often do you think about your bowel movements? Probably not much at all, unless something goes wrong. And if something is going wrong, how long might it take to talk to someone about it and see a healthcare provider to find out what's happening? My guest is Dr. Iris Wang, who is an assistant professor in the Division of Gastroenterology and Hepatology and the associate program director of the GI Fellowship at Mayo Clinic in Rochester, Minnesota. Reducing stigma and opening up communication around pooping is so important to Dr. Wang that she wrote a book about it. Her children's book is titled Can't Poo, and it follows a young ghost through his journey with constipation. We talk about why she wrote this book, what her goals are, and how parents can help their kids learn how to poop the right way. Plus, for those of us who are parents living with an IBD, Dr. Wang offers her advice on how to be watchful for symptoms in our kids without becoming hypervigilant. Dr. Wang, thank you so much for coming on About IBD.
Amber, thank you so much for having me. It's really an honor to be here.
Oh, it's absolutely my pleasure. Having circled around one another on the Twitters for a while now. So I wonder, though, if we could get started by having you introduce yourself to our listeners.
Yeah. Hello, everyone. Good morning, good afternoon, wherever you are. My name is Dr. Xiao Jing Iris Wang. I'm an assistant professor in the Division of Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota. And I'm also the associate program director of the GI Fellowship. I focus on general GI, but really have a really big passion and interest for what's called disorders of gut-brain interaction and the area of abdominal pain.
Right. And that's one of the reasons why that you're here today, Dr. Wang, with me, is that you took this passion and you turned it into a children's book. I was listening to another podcast that you did recently. You were on the Curbsiders, and you said in that show that your goal was to write a children's book, and goal achieved. So it's really exciting. And I wonder if you would tell me about the story and about the main character. The main character's name is Boo.
Yeah, thank you so much. And I have to tell you, it really is kind of one of the most fulfilling accomplishments, right? It really feels like a dream come true. And process is just so different than anything that I've been used to before. And it's been such an exciting journey to learn about this new world of publishing, and to have someone actually validate this thing that I produced is just amazing. So Boo Can't Poo. First of all, his name is Boo because I needed to rhyme it with poo, and what better way to go, right? And I think when I was first shopping around this book, people were like, why a ghost? Like, does he have to be a ghost? And I was like, well, no, he doesn't have to be a ghost, but his name is Boo. Yeah. And I think that people, there's a lot of stigma around toileting and poop and, sensitive areas of the body. And I just thought, well, if we make it a ghost, we can make it an idea that's fun, that's cute, that's more acceptable, and maybe a little less targeted and personal for kids who might be struggling, or it'll be easier for folks to accept that this is just a fun book, but hey, as you're reading it, maybe you'll learn something. So you referenced the Curbsiders, and I remember it's like kind of what is a highlight of my career, right? I've been so fortunate to cross paths with these amazing people. And I was joking. I had been joking for a long time in my fellowship that I need to write a children's book about how to poop, because I do a lot of counseling around constipation. And while that might not be a huge issue for the IBD population, it's a huge issue overall and happens in the IBD population as well. And I started learning about the pelvic floor. And that saying, like online, like I was today old when I was like a first year GI fellow when I was like, wait, why do GI doctors care about the pelvic floor? And at first I thought they were joking. I was like, what, why are we talking about this? But then I realized how integral this pelvic floor is to constipation and how much the muscle movements really impact our ability to be able to evacuate a bowel movement and how often that went wrong. And people don't know it goes wrong because it's not a muscle that we're aware of. It's not a set of muscles that we've been ever taught to think about or control unless you're unless you gave birth recently and somebody like mentions some exercises, right? But it's a muscle that everybody has and nobody talks about.
Mm-hmm.
And so as I was explaining this to my patients over and over and over in our clinic encounters, they would be like, well, nobody told me I wasn't supposed to do this.
Mm-hmm.
And it was just this like aha moment over and over again. And I was like, you know what? I should tell people that they should do this, that they shouldn't be pushing when they poop. And I started, at the same time, I had a kid. As he was aging in my like parenting tiger mom nature, I was like, I have to read books to him, all the books, all the time. And so I was reading all these children's books. And my thoughts were all in children's book rhymes at that point.
Mm-hmm.
And I started looking at what's available for children to teach them how to poop. And there was very little, right? There was a lot of books about toilet training and getting used to the potty and normalizing the idea of poop, which is all amazing. But it doesn't really go into the nitty-gritty, and advice. And on the other hand, there were all these amazing books coming out about the body and teaching kids general chemistry for babies. I love that series. And I was like, well, why can't we have that for poop? Mm-hmm. And so I kept thinking about it. And then literally one Saturday, I was like, why do I keep joking about it? Let's just like write something and read it to the 3-year-old and see what happens. And so I wrote something and the 3-year-old loved it and nobody else did for a year and a half until I finally struck gold and my editor gave me a chance. Yeah. That was a very long story. I hope that answered your question.
It does. And it makes perfect sense. Okay. So we were talking a little bit before we turned on the recording that, obviously poo and pelvic health and colon health is a big topic of conversation around your house. It is also one around mine. And the idea of the taboo or the stigma or that people don't want to talk about it. I had a babysitter years ago when my daughter was a toddler and we made up rhymes. We made up songs about toileting. I had one kid who was diarrhea predominant and one kid who was constipation predominant. And so we kind of went back and forth. And so one day my daughter was singing the little rhyme or the song that we'd made up. And my amazing babysitter says to her, we don't sing songs about this, going to the toilet. And I was like, I had to shut that down right away. I was like, oh no, yes, we do. We absolutely do. Maybe not in your house or other people's houses, but in my house.
Yeah, absolutely. I mean, even now, right? They're called potty words that you're not supposed to say. And one of those words includes like potty and poo. And I get it. But on the same, token, like this is our bodies. Like when we talk about normalizing things and celebrating our bodies and teaching kids body autonomy, right? It's so important to name things. It's so important to just be able to talk about them.
Yes.
Yeah.
Absolutely, 100%. And we do. Sometimes I have to be told to stop. So I have a copy of your book here. It's amazing. I loved the illustrations. I'll tell you that when my kids came over, when my kids come home from school, I'm usually working, so I'm at my desk. And they came over to my desk and the book was sitting there. And even though they're teenagers, they were very interested and they wanted to look at it. And so the first reading of the book that I did was with my teenagers. So I thought that was fantastic because the book is more for aimed at younger children, but I think everybody can enjoy it. So I want to talk about the illustration. So I'm wondering if you could talk about how you made some of the decisions. You already talked about how you decided it was a ghost because Boo can't poo, but then also reducing stigma because Boo is a ghost and I don't know if we know what his digestive tract looks like. But anyway, so I'm wondering how you made the decisions around how to show things like poop in this book, because you kind of have to.
Yeah, absolutely. And just to go back to your prior point, the book is aimed at toddlers, early readers, but it's secretly aimed at their parents. So it's an open secret.
100%.
Everybody needs to learn how to poop. I have to give so much credit to my amazing illustrator. Her name is Ro Lidsma. And she's an artist based in Barcelona, and the publishing company found her. And we had been looking at art samples and samples from various illustrators, and her illustrations just really spoke to me, right? I think I have to give her all the credit for truly bringing Boo to life. Because if you saw what Boo looked like when I first drew Boo, I don't know if your teenagers would have been necessarily interested in that. But I think part of her illustrations, and, as we went back and forth and made suggestions, I think it was about, there's a cuteness factor there to draw in the kids, to make it okay, right? To make it fun, to make it approachable. I thought she did such an amazing job with Boo's facial expressions, right? That you can tell he's constipated. You can just tell that he is struggling, and you can celebrate with him when there are any changes. We don't know, does Boo poo? But
twist.
I think I think she just we kind of made decisions, and my early mock-ups were to show, yes, it's a ghost family, right? But we can kind of, in the same idea that we give human characteristics to animals, and I'm not remembering the specific name for that term, but it helps us relate to these characters without it being too close, without it being stigmatizing or accusing, right? It helps us learn. It's like a fable, right? Or a story about, the fox, the turtle and the hare. It helps us take these concepts and apply it to our lives without it being directly like your doctor is telling you to do this. It kind of, you can relate to this story and think about, what Boo has to do to make this poo happen, and remember, hey, maybe I could do that too. And I wanted it to be a family, and I wanted it to have these components that Boo can ask for help, right? Because that's so often the issue, is that kids think that, or we have this idea that we can just do it. It's a natural bodily function. Why can't you just do it? Everyone does it. Everyone poops, right? That's the message. Everyone poops. But not everyone poops correctly. And it is so important to ask for help. And so that was part of the idea too, is to have this family of characters and who have different personalities and their different vibes, and they're espousing different healthy habits. And yeah, I think that, she really took those words and the ideas and my preliminary, rudimentary, not very good drawings, and made them so accessible for kids and so attractive. And I just could not be more grateful or more happy with how it came out.
Yeah.
She's amazing.
Yeah. Well, it worked here because my kids immediately, well, of all of the things that are on my desk, they went for it immediately. And I thought it was really very funny.
That's so wonderful.
So you said that the secret of your book is that it is really aimed at everyone and also parents. So what do you hope parents and the kids take away from Boo's story?
Yeah, I hope that they take away some practical pointers for how to, and it's really aimed at kind of preventing constipation or stopping it when it first starts, or when it kind of starts happening, right? And so some really easy, accessible lifestyle and diet interventions. I hope that they learn about the pelvic floor and pooping mechanics. And that's kind of my big, I don't want to give away the whole book, but it is really important not to push. If you're pushing and pushing for every bowel movement like that, we need to talk about that, and we need to kind of adjust so that that's not happening, right? Because that can lead to long-term consequences. It's okay to push occasionally, but you should not be pushing to get every poop out. And I think that's a message that that's one of my major messages that I'd like to send, is that it should just come out. And if it's not just coming out and you're always having to poop and strain and it's work to get that poop out, then there are things that we can do to make sure that that's not the case, right? That's actually constipation. I want them to normalize talking about difficulties having bowel movements. It's a normal thing. Everybody experiences constipation here and there, right? This is why I'm a GI doctor. It's because first people are like, why would you want to do this? And then the next line they say to me is, well, actually, I have this friend who has this thing. And I'm like, yeah, your friend. That's okay. Let's talk about your bowel movements. Let's talk about the fact that sometimes people have issues with their bowel movements. It's part of life, but it's when you don't talk about it, when you don't ask for that help, when you don't when you try to ignore it for too long, that things develop into issues, right? So to try to normalize the conversation and make sure that it's okay for kids to ask for help and have some tools available to them. I think those are kind of my big goals.
Right. Yeah, I know more than one parent that could benefit from reading this book. Coming up, Dr. Wang offers advice on how often to talk with kids about their poo. Dr. Wang, I was already talking a little bit about my own kids. I live with an IBD, so there's always a little bit of just worry in the back of my brain, even though I know that statistically it's pretty low that they're going to develop an IBD. But when they are having an issue, they're having diarrhea, they're having constipation, that little nagging worry is in the back of my brain. And this is also why we talk about bowel movements in my house so much, is because I want to know what's going on. And if something is out of the ordinary, I want to know, and I want to know right away. So I wonder if you have any advice as a gastroenterologist for parents like me, or parents that are not like me, that are just, trying to help their kids learn how to poop correctly, but something is maybe not quite right. So when should they talk to a pediatrician? And then maybe when would the pediatrician say, okay, it's time to see a gastroenterologist?
Yeah, that's a great question. And it's a really difficult question to actually answer. I do, kind of in the back cover of the book, there's a little bit about when to seek help, right? And when should parents really, if it's not working, right? When do you seek help? And I think there's a couple of things that are what we call red flags as doctors, right? And those are like, if there's blood coming out and a lot of it all the time, then it's time to see a doctor. If your kid's not eating, right, or they're losing weight, and it's, there's a lot of change around that. If they're having trouble leading their lives, it's well beyond time to see a doctor. Those are kind of the areas where we would really worry: weight loss and blood. Everything else gets a little bit challenging. And the reason I say that is because I deal with disorders of gut-brain interaction where symptoms are pain, right? And symptoms are often unexplained. And often you go to the doctor and there's nothing wrong on the testing. And it gets really challenging for parents. And let me caveat that by saying I'm not a pediatrician, right? I'm not a pediatric gastroenterologist. I don't treat kids predominantly. I treat adults. But I treat kids when they become adults.
Yeah.
I treat the 20-year-olds who come to the appointment with their parents and tell me their stories that have been going on for 10 years. And I see the suffering, right? And I see how well-meaning and worried their parents are because they have been on this journey for so long and there are no answers, or there is still a problem and their child is suffering, right? I'm a parent. That is so tough, right? There's nothing to make that better. And I think it's important, and the message that I've been trying to get to parents is that it is important for you to be vigilant, but not for your child necessarily to be so vigilant. And it's important to give your child that autonomy over their own bodily functions. Teaching your child like you do, right? Like you do, what does a healthy bowel movement look like? And then telling them, okay, when this doesn't happen, I need to know about it. As opposed to every day asking, did you poop? What did it look like? Is there blood?
Right.
Where they're like, oh, mom is going to ask, so I have to pay attention. Mom is going to ask, so I have to pay attention. Like it wires their brain to pay such close attention to their bowel movements that it's too much attention, right? The bowels don't need all that much attention, just a little bit. And so it's about striking that balance of teaching your kids what is normal, and then to pay attention when they feel off, that to be in tune enough with their bodies to recognize when something is off. And then that's it. They don't need to be any more in tune with their bowel movements than that. And it's a very vague answer, and I recognize that. But from a mom's standpoint, right, I want to be in the bathroom looking at his poop like every day because I'm a gastroenterologist, that's what I do. But I have raised a child who's like, screams from the bathroom, Mom, I made 3 big poops. And I'm like, great. And then we're done, right?
Right.
Like, and that's all I think I want, because then when he doesn't, or when his poop looks weird, he knows to call me. And that's good enough for me, right? So that I'm not teaching hypervigilance. And this is so important around pain. But that's a whole nother story. But I'm teaching him to be vigilant for himself and recognize what's wrong.
Your point is well taken, is that we want to destigmatize and we want our kids to come to us when they have a problem. I've spoken with many IBD patients who had problems young as children and did not express anything to their parents or their caregivers. Everyone has a different reason for it, but to have that communication open, but then also, and I tell my kids that they should look at their poo. You don't have to look at it every time, but give it a glance. But to not get to the point where they're actively worried about, because it should be, before I was diagnosed with IBD, I don't remember what having a bowel movement was like. It was that uneventful in my life before the symptoms started. So I almost feel like that's kind of what you're going for.
Yeah. It should be uneventful.
Uneventful. I love that.
So that when it is eventful, that you say something. And that's your other point, right? Like, you validate your children when they tell you. You validate your children. You kind of keep an eye on like what their normal is, so that when their abnormal happens, like, that it's abnormal. Or if you don't know it's abnormal, like when they're worried and they're telling you about something, even if you think it's not a big deal, hey, thanks for bringing that up. I see why you're worried about it. This is okay, but let's keep an eye on it so that they don't think that they can't come to you the next time.
Open communication. I think
Absolutely.
Actually that's one of the biggest things about parenting. So, all right. I'm guessing that you have learned so much as you've gone through the process of writing and then finding an illustrator and then now you're going through all of this of marketing this book. It's, I don't assume that anything in your medical training has really helped you very much with this. Can you tell me something that you've learned through this process?
It was the utmost lesson in humility. I am where I am. I've had a pretty reasonably successful career to this point. I've been very fortunate. And I have faced my share of paper rejections, grant rejections, things like that.
Yes.
But they usually write back and they're like, no, sorry, we're not going to take this. Or sometimes it's like, sorry, we're not going to take this because of X, Y, and Z. When your grants are rejected, you get some feedback about what you could do better.
Nice.
Agents, they just ghost you. Like, there's just no response. Like, there's nothing, right? Like, and their websites are so open about that. Literally, like when you send author inquiries to an agent, which you may have experienced, hopefully not, but it literally says, like, expect not to hear from me if I'm not interested. Right. And so I had this recurring timer on my email that every 6 weeks I would send out another batch to children's book agents inquiring whether they'd like my book. I had such a great pitch. I was like so proud of myself. And it was a year of crickets. And after every bout, I would have to lick my wounds a little bit, be like, this is just the name of the game. Like, you read about this. It's fine. Maybe I would self-publish. And then I would be like, I don't have time to self-publish. Where am I going to find an illustrator? Let me just try again, over and over and over again. And let me tell you, when I got that email that somebody was interested, I felt like I won the lottery. I still feel like I won the lottery, and I still feel so fortunate that my editor saw something in this book, and it's such a humbling experience, and it's such a different publishing experience than peer review, right? Where I've got these papers that will go out to the medical journal, and that's great. But this means so much to me, and means so much to me as a mom, as a gastroenterologist, as someone who's an educator, right? That I get to teach people, who otherwise wouldn't come to me. And I can reach, hopefully, so many more children and their parents to help and to just teach them something about their bowels. It's amazing. And I'm brimming with gratitude and this opportunity. I'm so grateful.
With the focus in the ether and on social media and everywhere on gut health, the idea that a gastroenterologist pitching a book about about a children's book that's fun about going to the bathroom that somebody would not be interested. That's wild to me. That's wild to me because I feel like it's gold.
I mean, right? That's what I thought in my head, but we're in GI, right? And it's just so interesting to see, like, what is the world of publishing like, right? And with self-publishing, it's a whole new game. But yeah, like I think there's still so much stigma around poop.
Yeah.
It's because the book was about not the microbiome, but it was about poo. And it was a little weird, apparently. Apparently people aren't like us and talk about bowel movements over the dinner table.
Well, that's too bad because I think it would benefit everyone a little bit to loosen up around these things. And maybe more teenagers would come to their parents when they're having an issue.
Yeah.
So, all right. Well, I want to ask you a little bit about yourself, though. I know a little bit about you from following you on social media for a while and listening to the other shows that you've done, which I will put links to them so that everyone can benefit from them because you have a very you have a very plain language way of explaining things, which I think is fabulous. So even though it may be aimed at doctors, you say things in a way that everyone can get something out of it. But I want to ask you about your career as a baker. So tell me, I do a little baking myself, just as a home baker. It's more like stress relief for me. So tell me some things like what are your favorite things to bake, or what does your son ask for?
My son is a food snob. I have raised him well. When he asks for cookies, he's like, "Mama, can I have a macaron? Can you make macarons?" And that's my cookie of choice, if you will. I've got two games. I've got a macaron game and a sourdough game. But the sourdough game is largely what I do with the sourdough discard, and I have an amazing chocolate chip cookie recipe. But the macarons are my, I'm going to say my claim to fame, but really like my baking go-to because I am a type A overachieving perfectionist. And so, what bakes good better than the French macaron, right? Where it's actually so simple. And I started off with that because I would be watching. This is all the Great British Bake Off's fault. But they would just be like, "Oh yeah," and then I whipped up these macarons as like, this extra decoration for my 3-tiered cake, and I'm like, "Well, if they can do that, right? Like this must be achievable." And then I started getting down the rabbit hole. Right, macaron making is a rabbit hole. Oh, the number of like troubleshooting blogs I've read, the number of books I've acquired to be like, okay, but I did it right. Like, why do they look like this? Why are they still lopsided? And you know what, like the secret of this is like, I don't even like eating them. It's they're like, I don't enjoy eating them, which is really, really important because otherwise I would eat all of them and nobody would get any. And I would have to spend a lot more time at the gym, which I do not have time for. So I love the macaron. It's kind of like a technical challenge, but it has so many like varied options for different flavor combinations. It's gluten-free, which is always a plus. I can give it away to many more people. And I've learned to tweak where I can to make it a little bit more to my taste. So I've enjoyed more about eating them. And they look impressive, like it's kind of, so yeah, it's a nice challenge. What's not great about it is trying to travel with them or share them with people. They are very finicky and they are persnickety. I've managed to do it a few times, but it's difficult.
I think there's a through line there between being a gastroenterologist and making a macaron. I feel like so many moving parts, so many things that you have to manage, and you have to do things just right. I feel like that makes sense, that's your cookie of choice, that's the thing that you go for when you go to bake.
And you can personalize, right? You can like customize depending on your patient and their needs and exactly like what is it that's causing their issues. And you can kind of mix and match your flavors.
That's very funny. There's an essay in there somewhere. So, all right. So we want everybody to order Boo Can't Poo. Where can people find your book, Dr. Wang?
So it's published by Mayo Clinic Press, so it's available on their website for pre-order. It's also available on Amazon, on Target, wherever you buy your books. It is available for pre-order.
Perfect. And I have my copy already, so I'm just like, I'm so excited about it. And then also you have quite a great social media presence for yourself. You've been promoting the book there, but then also you share out lots of great things having to do with, what we're going to call, your day job as a gastroenterologist. So where can people follow you across social media?
Yeah, I'm on Instagram. I'm also on X, formerly known as Twitter. And the handle for both of those is going to be @IrisWangMD. And you can learn about my GI fellows and all of their shenanigans as well.
That I do love very much, actually. So
they're amazing people.
Yes. And I love to see your journey as a mentor. Watching that is really great.
Thank you.
Dr. Wang, thank you so much for coming on about IBD. Thank you for writing Boo Can't Poo and for talking with me and helping me work through, as a parent, how we can approach bowel health with our kids. So thank you so much.
Thank you so much for having me, and thank you for promoting the book. It's an absolute joy to be here.
Hey, super listener. Thanks to Dr. Wang for making time to talk with me and for her advice on how not to get too worried about our kids' bowel movements. Her book, Boo Can't Poo, is available to order right now and will be released on July 16th, 2024. I love to give books as gifts, especially to children, and I look forward to adding this one to my rotation. You can get your copy at all the big booksellers, bookshop.org, or you can ask for it at your local bookstore. I will put links to all these sources, plus the ISBN number in the show notes. As always, links to a written transcript, everyone's social media handles, and more information on the topics we discussed is in the show notes and on my episode 153 page on aboutibd.com. Thanks for listening, and remember, until next time, I want you to know more about IBD. About IBD is a production of Mal and Tal Enterprises. It is written, produced, and directed by me, Amber Tresca. Mix and sound design is by Mac Cooney. Theme music is from Cooney Studio.